Hi, my name is Olivia and I'm going to demonstrate how to do quality control on our IDEX Catalyst machine. Quality control for IDEX machine, you must use your vet lab station to choose instruments. I want to do catalyst. I want to do quality control, and I need to make sure that it matches the sample that I have from for the quality control serum. Quality control serum N5604, that's what I want to choose. Vetrol, run quality control. This sends the requisition over to the catalyst. I choose it, and then I want to load. Alright, I want to load my sample, the quality control sample, make sure it's mixed together. Alright, I want to get exactly 300 microliters, so I've got a pipette to measure it. Draw it up, put it in my little sample cup. Next I want quality control slides, or clips I mean. And I load those into the machine. I can open it. And kind of do that, make sure they don't stick together. Then I load my sample. I can go ahead and hit run. And then in a few minutes it will tell me my results. Our quality control has finished, and I want to view the results and make sure they are normal. I want to just select Vetrol, view. Our results are good, so quality control is working. Everything looks good, and it is saved, date, and all that, and so that we can track it, and we do it once every month. Thank you. So this is an ELISA 4DX Plus test. It's to check for heartworm and tick-borne diseases such as anaplasmosis, Ehrlichia, and Lyme disease. And what I want to use, I've got our patient's blood. It's got a little bit of heparin in there so it doesn't clot. I want 3 drops of sample, and then I want 4 drops of the correct conjugate. And I want to mix this really well. I'll pour it in the well, and I'll wait until the sample and conjugate reach the edge of this small indicator hole here, and then I'll snap it and time it for 8 minutes. It has now reached the very edge of the indicator, and I can snap it and then set my timer for 8 minutes. So time's up on our ELISA test, and just the control is showing. So we've got a negative test, negative for heartworms, and our tick-borne disease panel. Thanks. We'll do a fecal flotation with centrifuge, a regular fecal flotation, a direct smear to check for protozoan parasites or even just ova, and then also a sedimentation to check for any flukes or tapeworm eggs. So the flotation solution is designed to help those parasite eggs float to the top and stick to the cover slip so that I can look at it under the microscope and see if I can see any eggs. And mix it up really, really well. I take a piece of gauze to strain it. Of course, I got my funnel here to make sure I don't make a big mess. And I'm going to fill it up to where I get a nice meniscus on the top. So that I can put a cover slip on and see what's in there. You really should have at least 1 gram, 1 to 5 grams of feces in order to get a more accurate test. There we go, now it's running in there. It's pretty thick stuff. Okay. That was fun. So now I'll go ahead and throw this away. And then I'll fill it up the rest of the way with my solution and let it sit for about 15 minutes and then check it on the microscope. I got to make sure I clean off my funnel really well for the next test. Don't want any contamination, of course. Okay, so I got a nice meniscus there. Apply a cover slip to it. Perfect. And then I'll set a timer for 15 minutes. Okay, for my next trick, we're going to do a fecal flotation and centrifugation. So again, I got Buster's sample here. I got a handy tea strainer. And I'm going to do the same thing as the fecal flotation. I'm going to strain the feces with the fecal solution into my beaker and then centrifuge it and make sure I have a balancer in it as well. Okay, so I'm going to centrifuge this sample with a balancer for 10 minutes at about 1500 RPMs. The centrifuge has finished centrifuging down my fecal flotation. So this is the flotation with centrifugation. I'm going to continue to fill up this beaker until it gets a meniscus at the top, and then I'll apply a cover slip and start my time over to get those eggs to float to the top here as well. So I'm going to do a direct smear fecal test. I got my slide right here and got my cover slip. I'm going to use saline on my sample, of course. Put equal drops of saline with an equal amount of sample. Again, it's about an equal amount, and then mix it together really well. Right, a good amount of mixture here. I want to apply my cover slip. And then check it out under the microscope. This fecal test I'm going to run is a sedimentation. And the reason we check the sediment rather than a float is to check for those parasite eggs that are too dense to float to the top, and they actually will sit on the bottom. For the solution I'm going to add to this is actually just normal tap water. I'm going to centrifuge that down, pipette off the supernatant, and then take a sample and look at it under the microscope. Tea strainer. I got my sample with the tap water. Strain it down in here. Then I'm going to centrifuge it for about 5 to 10 minutes. My sedimentation has completed its centrifugation. So I'll go ahead and take that out, pipette off the supernatant, and then get a sample of sediment that's on the bottom and look at it under the microscope. Okay. And I've got a slide here marked S for sedimentation. Take just a little bit. Sample here. Place it on my slide. Look at it under the microscope as well. Again, I'm looking for those parasite eggs that are a little too heavy to float to the top in a regular flotation. Okay. Then I got my slide marked C for centrifugation. My slide marked F for flotation. Okay, now I'm ready to check and see what we got. So I have checked all of our tests. No ova and parasites were seen on our sedimentation test or our direct smear, and no ova or parasites seen on either of our floats, the one with the centrifugation and just the regular float. Okay, Katie, gonna do an ear smear here. So I'm gonna open up this ear flap and get inside, sweetheart, get a good sample, such a sweetheart. Oh, it's itchy. Yes, that was the right side. I'm gonna do the left. Such a sweetheart. Yeah, I got some dirty ears. Come here, honey. Oh, you're so good. Yes. Good job. All right, thank you. Now I'm going to apply, gently roll it on the slide. See, I'm going to do my left side actually on the left here. And then the right side on the right. Properly heat fixing my slide. Get the heat lighter. A couple of times across the flame here. Okay. And then I want to put it in the fixative, the first methanol, for 4 dips. And then 7 dips in my eosin stain. About 9. And about 7 to 10 dips in my thiazine stain.
So the box and the extra very fine.
Okay, so about 8 dips there, and then I'm going to rinse my slide off and dry it and look at it under the microscope. Gentle rinse of water. So I'm going to put a little oil on the slide. And see if I see any bacteria or yeast. Alright, so this, wow, this poor cat has tons of rod bacteria and cocci. This is the left side. I'm starting with the left side. Poor cat. Okay, and I'm going to move along over to the right side. It's the same on the right. Lots of rod bacteria, lots of cocci. So this dog has a lesion on his back leg that I'm going to take a couple of samples, hair samples for a DTM culture, a fungal culture, and then I'll do a skin scraping as well to check for mites. So first of all, I'll just kind of use my brush and collect the hair along the lesion, and I'll submit that for culture, for fungal testing. Got some hair on there. And then I'll want to take a couple of pieces of hair, maybe some little scabs too would be good. And then I'll place that in the fungal culture as well. So now I also want to take a skin scraping, and I want to use a dull blade and a drop of mineral oil. So I put a drop of mineral oil on my slide. And I want to dull my blade. Put a little mineral oil on this. And I want to scrape enough skin to where I just show some blood so that I can get underneath that hair. And I go along the hair just so I start to see a little blood. Okay. Alright, so I think I got a good sample here, and I'll look at it under the microscope. So far I don't see any mange
much. I'm going to also look a little closer, just in case I miss anything. Look a little closer on the 40X, because I don't want to miss anything. Lots of debris and hair. Some blood. I do not see any mites, so that's great news for my dog.
We've got our dermatophyte test medium here. As you can see, there is growth. It's not quite the usual color that most of our dermatophytes would be. They're usually supposed to be a white, fluffy colony. There is some redness change. You barely see. It is starting to turn red. Again, there's not much of a fluffy colony. It's mostly a green colony surrounded by white. So most likely what we have is a contaminant that has grown in there. I'm going to go ahead and demonstrate collecting the growth and putting it on a slide so that we can look for macroconidia under the microscope. So I've got my slide. So what I'm going to do is take a piece of the growth from inside my bottle here. Try not to get the actual hairs, but the growth. I don't want the hair. Let's see, take it from the outside. There we go. Put a drop of saline on there to get it off my there. Sometimes these buggers don't want to come off. There we go. Got the growth on there. Put a cover slip on it and look at it under the microscope. Got my slide here, and I'm going to look for macroconidia. Alright, I found my sample. Okay. Alright, I found my sample, and there's a lot of hairs on there. Definitely some growths, but I do not see macroconidia growing off. We will wait a total of 30 days before we can call the sample completely negative. It's been only about 15 days worth of growth at this time. Thanks. I'm getting ready to perform a necropsy with our doctor. We're going to use a male rat, unknown age, unknown species of rat. Instruments here. Rat was dead on arrival. I've got various scissors, Metzenbaum scissors, Mayo scissors, a needle holder with a blade, suture just in case, several mosquito hemostats, forceps as well, various, and then Alice tissue forceps.
Okay, we're getting ready to do a necropsy on this rat to look at him grossly. His body condition is good. His limbs seem to be pretty normal. He's got testicles present, no abrasions or bruising on the skin, so that's good. So what we're going to do is we're going to cut into the abdomen and then take some biopsies to submit for histopathology. I'm going to make an incision from the xiphoid process down to the brim of the pelvis, through the skin, into the abdominal cavity. Cutting through the body wall. And then we are going to look into the abdomen and see what we have here. That appears to be the cecum, which is emptying out into the colon. And then here is the small intestines, and you can notice the omentum. They look pretty normal. We have, I'm not sure if you can see this, but we've got this is the stomach here. The stomach. This is the spleen. Here's the liver. So what we want to do is get biopsies of the major organs.
We've got biopsy jars here that I will open up and label what each organ is and who the rat is.
So there's the spleen. I'm going to take a piece of that. Put that in formalin.
This is fun.
All right, and then here is the liver. Grossly, the liver looks normal. So we're going to take a piece of that, submit it in formalin.
I will label this one as a piece of the liver.
We're going to look for the kidneys, which there is the kidney. Now grossly it looks like a normal size. It does appear to be hemorrhagic and not sure why. So we are going to take a piece of it. Both kidneys look to be the same. There's a little capsule. Actually, as small as it is, I'm just going to take the entire kidney.
Okay.
Okay.
Thank you. Thank you, Dr. Sears.
You're welcome.
At this point, my rat patient is going to be cremated through Pet Angel, and if this were a rabies case, we would have to have the head removed and sent into a special diagnostic laboratory for rabies-specific testing. Thank you.
In regards to rabies, only our head technician who's been vaccinated for rabies and our doctor who's also been vaccinated and titers pulled are the only ones allowed to handle our rabies suspects. In the case of a euthanized or dead animal, the head must be removed safely by the doctor and placed in 2 biohazard safety bags, sealed, and replaced in the refrigerator until they can be picked up from the UK diagnostic lab for rabies-specific testing. The remainder of the body must be placed in also biohazard bags and cremated according to the standards of the cremation company. When doing a necropsy on a rabies suspect patient, again, only the head technician and only the doctor is allowed to handle it. They must wear gloves, complete gown, goggles, and hairnet to be safe.
I'm getting ready to do the vaginal cytology. I'm going to go ahead and wet down my swab there. First, I'm going to clean off her vulva so I can get a good sample. I start from the inside with some chlorhexidine and go out towards the outside. Knit really well. And I got my swab here, and I'm going to go in through the vulva at a 45-degree angle. Make sure I get into the vaginal canal. Just gently roll it to get the cells. Here I have my cytology, and I'm going to gently roll it across the slide so that I don't ruin any of the cells. And then next I will stain it and look at it under the microscope. Okay, so it's time to stain my vaginal cytology. First I want to dip it in the fixative, or methanol, for about 5 to 10 dips. And that fixes the cells onto the slide. And then I want to do my eosin stain. And then I want to do my thiazine stain. These are diff quick stains. Okay, and then I gently want to rinse it off, dry it, air dry, look at it under the microscope. So I do not see so far any cornified cells at this point. I just see some intermediate cells, some parabasal cells. I don't see any red blood cells. I do see some white blood cells, inflammatory neutrophils, basically. Just peruse around here and looking. I do not see any cornified cells. I believe this dog to be in anestrus. There are no behavioral signs during anestrus. Proestrus is the beginning of the estrus cycle. The estrogen increases as the follicle develops, the uterus enlarges, and red blood cells will start to leak from the capillaries. And proestrus lasts for about 9 days. The male dogs will be attracted to the female dogs, but she will have a swollen vulva, but she will not be receptive to the males at this time. Go into the estrus cycle where our estrogen has peaked and is starting to decrease now, and our progesterone is starting to increase. The female is now receptive to the male. So there are behavioral indications that she's in heat. She'll have a swollen vulva, and she will have several red blood cells on that cytology, cornified cells on the cytology smear as well. That lasts for about 9 days on average, and then she will go down into diestrus, and that is when the progesterone levels peak. There are cellular changes, and the diestrus can last about a month to 3 months. The entire estrus cycle can last months, 3, sometimes 4 months total. And then, of course, you have a space between about 6 to 8 months between the anestrus to the next estrus cycle. Thanks. Okay, so I'm getting ready to do a cross-match agglutination test with Bella, who's our recipient, who is sick, who may need a blood transfusion, and our potential donor is Gru. And I'm going to test a major cross-match and a minor cross-match to make sure that they are compatible and that Bella can have a transfusion from Gru. Our major cross-match is between Belle's serum with Gru's red blood cells washed, and the minor cross-match is between Gru's serum with Belle's red blood cells. Now I want to wash my red blood cells. I got my sodium chloride to use as the solute. Get my blood out. This is Bella's red blood cells. I'm going to place 1 to 2 drops of red blood cells. And fill the rest of the tube with saline. And I want to do the same with Gru's red blood cells. And then I centrifuge it down at 3,500 RPMs for 1 minute. So we repeat the process of washing the red blood cells 2 more times by removing the supernatant and putting the sodium chloride back in a couple more times to make sure they're washed. Now I'm going to transfer my washed red blood cells into about 0.98 cc's of sodium chloride into new tubes. So first I'm going to get my sodium chloride ready. I'm going to start with Bill's first. And I'll put some in Gru's test tube. Make sure I measure it correctly. And they are labeled correctly. Washed red blood cells. So now I want to remove 0.02 mils of Bill's blood into Bill's washed container. Okay. Okay. So now I will do that with Gru's red blood cells as well. Got new tips for everything. Okay. Now I have my washed red blood cells ready to go. Now I'm ready to start my cross matching. So I want to place 2 drops of the recipient's serum with 2 drops of the donor's cell suspension in a new tube. So for my major, I've got Bell's plasma for my major. So I'm going to take 2 drops of Bell's serum and mix it with 2 drops of Gru's red blood cells. Gru's red blood cells here. Two drops in here. Mix it. Doesn't look like there's egg agglutination yet. Let that sit there. There's my major cross match. And then I want to do my minor cross match. And I want to use grease serum for that. And pipette here. Two drops of grease serum with 2 drops of Bell's washed red blood cells. Doesn't look there's any glutination yet. Not either. And then I also want to do my controls. So 2 drops of rose serum with bruised blood. Washed red blood cells. And then Bell serum. For Bell's control, 2 drops of serum, and then 2 drops of washed red blood cells in hers. Make sure there's no agglutination there either. This is Bell's control. This is Gru's control. So next, incubated our tests, our tubes here, at room temperature for 30 minutes. I'm going to now centrifuge them all down and check for major hemolysis, major agglutination, and then we'll check under the microscope for any micro hemolysis or micro signs of agglutination. I'm going to centrifuge them down for 1 minute. I've got my controls and I've also got my tests. See you in 1 minute. This is our minor cross match, and it actually looks pretty clear. I don't see any obvious signs of hemolysis. This is our major cross match. I don't see any signs of hemolysis in this one as well, but I will look under the microscope. And then each of our controls, they don't have any hemolysis on them either. Now I'll make a slide of the major and the minor and look under the microscope. Okay, so first I'll take Bell's plasma major, the major cross match. Under the microscope at the major cross match. Look under the 40X. And the cells look pretty good. There's no hemolysis. They look intact. There's no agglutination. So for a major cross match,
it looks like they'll be a good match, donor and recipient. I'll look at the minor cross match as well. Again, I'll look under the 40X, or the, yeah, the 40X.
Baby, you know, I've been dancing all morning.
And there actually is quite a bit of agglutination in this one. A lot of cells are stuck together. Most of them are intact. I don't see a lot of damaged or hemolyzed cells. But there's quite a few cells here that are stuck together. So I will speak with the doctor about whether the recipient and the donor are a good match.
So I spoke with our doctor regarding Bell and Gru, whether or not Gru was a good candidate for transfusing Bell with his blood. Because of the minor cross match, there's quite a bit of microscopic agglutination. In the controls, however, with Gru and Bell, neither of the control samples had any cell lysis or agglutination on them. So our doctor's not comfortable with using Gru as a donor for Bell. We're going to send Bell on to the emergency room where she can be blood typed and have an appropriate donor do the transfusion to make sure it's safe for her.